So you all know that our fluid needs are 25 to 30 milliliters or cc's per kilogram of body weight. When we look at that fluid needs handout that I have on Blackboard, we have decreased fluid needs here. That's someone with CHF or COPD, with edema, liver failure, kidney failure. And then increased fluids would be someone who has constipation, dehydration, diarrhea, they're throwing up, they have a fever. Remember this term fistulas, that's an opening from one organ to another, an abnormal opening that's not supposed to be there, any draining wounds, hot or dry environment, a medication like a diuretic. We just talked about furosemide and potassium. And then use of an air fluidized mattress. And that's somebody that would have significant pressure ulcers, so their fluid needs would go up, like you saw in chapter 5 in our text with our needs during pressure ulcers or pressure sores. So here's just a review of where we're going to have increased fluid needs or decreased fluid needs. But you're going to want to utilize that handout that I just showed you there for figuring fluid needs. Okay, so let's do a little practice with that. Let's imagine that we have a patient who weighs 125 pounds. Okay, and we are going to figure out their fluid needs. They're 125 pounds and they have excessive vomiting. Okay, so first thing we're going to do is get their weight of 125 pounds into kilograms. Okay, so I'm taking 125 divided by 2.2. They're 56.8 kilograms. Okay, then we want to determine with their excessive vomiting if they are in the increased fluid needs category or decreased fluid needs category. I'm going to see here that excessive vomiting, their fluid needs are going to be increased. So if we look back at this form here, we're going to take their weight in kilograms, 56.8, times 30 or 35, or you can do the range, so you can do both of that math. So I take their weight in kilograms times 30, and I get 1,704 milliliters of fluid, and that's on the low range, right? And then I'm going to take their weight in kilograms, 56.8 times 35, and I get 1,988 milliliters, which would be on the high range. So again, you can use a range of 30 to 35, or you can just select one. Okay. If you're working with a layperson and you want to give them a recommendation of how many cups of fluid that is, remember you can take that 1,988 milliliters and divide it by 240, and you get 8.28, or I would tell them about 8.5 cups of fluid per day, because we get 240 milliliters in 1 cup of fluid, or 8 ounces. Lucy, you just learned about that in foods class. So that's going to complete our discussion on Chapter 7 for today. I'm going to do an extensive review on Thursday that I'm going to post, mainly focusing on the different math skills that you're going to need to utilize to be successful with our assignments for Chapter 7, and then for that project where you're doing a full assessment. So take care, and we'll see you soon.